You know, we do a lot of work with the Rose. They do phenomenal work, and Dr. Raz is here to explain steps that a woman can take for her breast health. So let's talk about this. Let's talk about the importance of mammograms, and should anybody ever be concerned about the amount of radiation that they're getting from mammograms?
Yes, I get that question a lot.
Really?
Radiation from mammogram is really minimal. If you and I were to take a flight from here to San Francisco, that will be the amount of radiation we'll get anyways from cosmic radiation. So it's not a lot of radiation.
Interesting.
The benefit that you get is when you screen early at age 40, you're able to reduce your chances of dying from breast cancer by 40%. If you weren't to do anything, you'll get that much risk, right? So it's much helpful and much better for every woman to screen, just start screening at 40. When you screen, we save about many lives, 100,000 more lives if you were to screen, let's say, at 50. So the earlier you screen, specifically at age 40, that's the national guideline, the earlier we can catch cancer if you were to develop any, and you can save your life.
So you know for sure this is saving lives. You have like a number there that you believe it's saving.
That's right. Multiple studies have proven that we save countless lives from mammograms, screening mammograms specifically.
And we hear a lot that mammograms should start at 40, but you know, I just got a story pitched the other day about there was a 25-year-old woman and a 38-year-old woman. So how common is it for younger women to be getting breast cancer?
That's an excellent question. If we were to diagnose, let's say, all the breast cancers, about 1 in 6 is women that are under 50. And about 10% of those breast cancers that we find are under 40. So it's a significant number. Unfortunately, there are no national guidelines to screen earlier than 40.
Yeah.
And this is where self-breast exam comes in.
Does it feel like women are getting diagnosed younger? Like, is that population growing?
Yes, I think there are multi-factors to this. I think the good news is, since we have such great outreach, you know, thanks to you guys doing this excellent show, a lot of women are now cognizant of this disease.
Yeah.
That's correct. And that really helps drive this point to do self-breast exam. And when they feel something, they come in and I'm able to find the breast cancer. Maybe that's one of the reasons we're able to diagnose younger women.
Yeah.
But the incidence of breast cancer, why there are more now in younger women, it's a multifactorial thing. It's not just that we catch them early. It could be other things. It's an active area of research actually right now.
So going back to the self-exams, how often should women be doing that?
Yeah, that's also another question I get. Unfortunately, there's no great guideline to this, medical guideline. But the point is...
The answer isn't never.
Yeah, it's never.
Yeah.
You should do it.
Yeah.
But the basic tenet here is you should know your breast. So if you do it once a month, twice a month, or every 2 months, that's fine, as long as you understand this is how your baseline breasts feel. If anything out of unusual feels, then you should come in and get it checked out immediately. That's really the point. And
coming into the Rose, what are some of the services that you guys do have available for women?
Right, so we're ACR Breast Cancer of Excellence. High quality mammogram, ultrasound, we have bone density, tomosynthesis, which is 3D mammography. It's one of the newer technologies.
Okay.
Basically, it helps us catch cancer earlier, faster, and it reduces callback, meaning useless biopsies.
That's supposed to be the one that's good for women with dense breast tissues too, right?
That is correct. Yeah, okay. Yes, it helps us catch cancer earlier, faster.
And you guys have that really wonderful mobile unit. I know we don't see video of it right now, but you have the mobile unit that sometimes gets people's attention and it can come to their place of work or something like that, right? There it is.
That's right. We have 4 units. In fact, due to a generous donation from a great donor, we are able to expand to East Texas just this year.
Oh, wonderful.
So we go out, we do as much as outreach as we could, and try to help as many women as we can.
Yeah, and you guys are doing great work. So you did touch a little bit about, 3D mammography and some future of breast cancer, of mammograms and treatments and things like that. But what else do you see in the future for breast cancer patients? Right.
So newer technologies, you may have heard of CT scans. And when a patient gets a CT scan, they get contrast. Now we're moving into contrast-enhanced mammography, which will help us catch cancer even earlier. The more subtle cancers sometimes can hide from us on mammogram, but using this technology, we'll be able to catch them. The other newer technologies are abbreviated MRI that has been tested in multiple locations across the United States in major institutions. An MRI tends to be half an hour, but now we could reduce it to 5 to 10 minutes. And that's the most sensitive study you can have to catch breast cancer. So we're moving really quickly in terms of technological advancement and doing earlier screening. In terms of treatment, new kinds of targeted treatment for breast cancer are coming up due to research. And we're all hopeful that we could do targeted therapies and cure cancer faster.
Excellent work, Dr. Raz. I appreciate you coming in this morning and joining me.